Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Bauman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo Outpatient Program. Thanks for joining us today. We're talking about how does a person recover from a mental illness. To open up the discussion, first of all, for maybe some of our listeners out there, how do I recognize I have a problem?
Well, again, it's listening to your own feelings, listening perhaps to what friends, loved ones, people you trust may be mentioning to you as some difficult areas, and to actually work on overcoming the denial that is quite common, unfortunately, in a lot of mental illnesses.
Sometimes people have been living with anxiety or depression that's very difficult, and it's hard for them to see, because they've been living with it for so long, that it is a problem and that they could get help. So I think listening to others who reach out to them is important. Sometimes people feel a sense of shame or stigma about having a mental health disorder. And I think gradually as a society we're overcoming some of those barriers, but it's important to push through those as well and get help.
And it can be as simple as even going online and going to some websites that may give you some more information about this as well.
Sure. So for maybe some of our listeners out there, how do I get an accurate diagnosis and understanding if I have a mental health disorder?
It's important that you see a licensed clinician, either a psychologist, a psychiatrist, a therapist, who can help you look at the different symptoms and recognize what's going on.
And it does help, I think, to educate yourself, to learn from sources online or in books, so that you have a perspective on what you're experiencing and can bring that to the encounter with the licensed mental health professional. And often it's helpful to involve family in the evaluation.
Someone with a mental illness, can they recover?
Yeah, yes, definitely. I'm thinking, as we've talked about the different mental illnesses over the course of this, that there are a number of things that people can do as far as just basic daily habits, getting enough sleep, avoiding abusing substances, getting exercise.
I think also that it used to be that with a mental health disorder, people thought that they had a persistent and really not treatable disorder. Medications have been in greater use only for about the last 50 years. I think there's increasing specific therapies that help people, and there's increasing optimism that people can recover.
How does someone find a good mental health professional?
We've talked about meeting with someone who's a licensed professional, talking with family, talking with friends to get some names. Talking with your primary care doctor is frequently a very good source for that.
And it's very important you have a good relationship with your mental health professional. So sometimes I'll recommend to people, if they're not satisfied with the first person that they see, that they go on to meet with another person or two until they find somebody they feel comfortable with.
Sure. How do I find support from family and friends and others?
So there are organizations now that can provide a great deal of help. For those with more severe illness, the National Alliance for the Mentally Ill is an organization with chapters in most towns and cities now, and is a great source of support. And there are other informal sources of support locally as well.
Yes, there are some treatment programs that are quite helpful in San Luis Obispo. We have the Cottage Hospital Intensive Outpatient Program, and then in Santa Barbara,
there's also an intensive outpatient program which meets several times a week in a group format, along with some individual meetings. And for people who are in crisis and need the safety and intensive treatment of a hospital setting, we have an inpatient psychiatry unit at Santa Barbara Cottage Hospital, and advise people to come to the emergency department if they're in crisis.
I've got about 40 seconds. What can I do to help myself recover?
Part of it is being open and being willing to overcome some denial about possibly having a disorder, at least talking to someone about it. And there are also some basic things like exercise, getting enough sleep, nutrition, those kinds of things that are quite helpful.
It's these days easy to find information online and in books so that you can learn more about what you're coping with, and that helps you in your work with a mental health professional and in your self-care. And I would agree with Dr. Bauman that the self-care aspects of good sleep, exercise, good nutrition, staying connected socially makes a great deal of difference in recovery.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery.